Good afternoon, and welcome to the webinar on data privacy and COVID-19. I'm your host, Eric Ghysels. I'm Faculty Research Director of the Rethinc Labs, which is part of the Kenan Institute. I'm a Professor of Finance in the Kenan-Flagler Business School and Professor of Economics at UNC-Chapel. It is sometimes said that data is the new oil. Given the central role played by data today in the economy and society, it has been a challenge for industry leaders, for policymakers, and academics to define best practices in its data-driven world and to protect us as citizens and as economic agents. This has led to the so-called GDPR, or the General Data Protection Regulation, which came out of the European Commission. And the state of California actually also has enacted what is called as the California Consumer Privacy Act, which came into force since January 1st of this year, and is modeled after the GDPR. I'm delighted actually that one of the panelists today was one of the key members of the team that prepared the GDPR. COVID-19 has made these issues even more complicated. And I'll just give two examples. Nursing homes have been disproportionately affected by the virus. Some states in the United States reveal the list of nursing homes that have been affected. Other states don't. Another example is the fact that Apple and Google have joined forces in creating a contact tracing app to various acclaim. So these are a number of topics that our two outstanding panelists will address today. Before I introduce the panelists, let me just do some housekeeping. At the bottom of your screen, you will find the tab of Q&A. Please field your questions, typing them into the Q&A tab. And in the second part of this webinar, we will pose those questions or a selection of those questions to the panelists. Our first panelist is Daniel Castro. He is a Vice President at the Information Technology and Innovation Foundation, or ITIF. And he is the director of ITIF's Center for Data Innovation. He writes and speaks on a variety of issues related to data privacy, information technology, and internet policy. His work has been quoted and cited in numerous media outlets like Washington Post, Wall Street Journal, NPR, USA Today, Bloomberg News, and Newsweek, to name a few. In 2013, Daniel Castro was named to FedScoop's list of the top 25 most influential people under 40 in government and tech. And in 2015, U.S. Secretary of Commerce Penny Pritzker appointed Daniel Castro to the Commerce Department Advisory Council. Our second panelist is Thomas Zerdick. He is the head of the unit Technology and Privacy in the Office of the European Data Protection Supervisor. Previously, Thomas was a member of cabinet for the European Commission's first Vice President Timmermans, and was responsible as part of that team for issues such as data privacy. At the European Commission's Director General for Justice and Consumers, Thomas was a key member, as I mentioned earlier, in the team that prepared and negotiated the GDPR. I'd like to pass on to Daniel, who will be our first panelist. Thank you.
Thanks so much, Eric, for organizing the event and the introduction. So I thought I'd talk a little bit about what we're seeing here in the US in terms of digital contact tracing, as well as some of the legislation that we've seen around these issues. So to start off, even manual contact tracing methods often involve some digital tools. So, if just the typical way that public health officials would do this is they would go and they'd ask somebody, where have you been? But we've also seen, especially around COVID, where they really need to know this information, they might ask for things like, records of credit card payments. In other countries, they've even used video surveillance footage to see where people have actually been on certain days and who they might have interacted with. But here we're specifically talking about mobile contact tracing, so how you can use a smartphone and data from the smartphone to do the tracing. Here there's two principal methods that are being explored. The first is using geolocation. So geolocation is where you're using location data from your mobile device that's time-stamped so you know where people were and when they were there. And there's two ways this can be used. One, it could just be used in a very decentralized way where the information is just completely stored on your phone and you would use it basically as a memory aid. So if you have an infection and you're contacting public health officials and they ask you who you come in contact with, if you had an app like this running, you would then load up your app and it would help remind you, okay, these are all the places I've been, at least where I've had my phone. The other way it could be used is when it would be centrally stored in some kind of database. It could be a government database, it could be a private sector database. And then when somebody has a diagnosis that says they're infected or they have symptoms, that other people who are in those same locations would then receive automatic notifications. The second method that's being considered is what's called a proximity-based method. And here, what they're talking about using is Bluetooth beacons. So when you have your phone on and you have Bluetooth enabled, Bluetooth can send out these small signals, and these signals can contain anonymous identifiers. So these anonymous unique identifiers say, this is a random ID, and it's broadcasting this to everyone who is in your vicinity, and those phones are also listening for these broadcasts even as they're making their own. They record this information into a list, and then over time they have a list of all these devices that they've come into contact with. And the idea here is that it also can be done in one of two ways. It could be decentralized, so all this information stays on your phone. You have this long list of unique identifiers that you've encountered, but you don't know who these people are. And if somebody has a diagnosis, their unique identifier is shared with you, again anonymously, and the phone checks for a match. And if there's a match, it just says, somebody over this period of time that you came into contact with that might present some kind of exposure. The other way of doing it is making that centralized. So all that information is put into some kind of government database, and then the government notifies you if there's a match. It can still be done more or less anonymously, but it is being stored centrally. So we've already seen early on some states take the geolocation app approach. Utah created an app called Healthy Together that's available. I think they started in about April. North Dakota created an app called Care19, which is also being used by South Dakota. What was interesting about this app is that in North Dakota, they specifically had a very popular app that was used for North Dakota State University fans all over the country who wanted to watch sports with other alums. You would load up this app, and it was a kind of a mobile social check-in tool. So you check in and say, hey, I'm watching the game at this bar, and you could see where other people were. The maker of that app had approached the governor early on saying, hey, we have this platform. Let's just use the same geolocation tool for contact tracing. So that's why North Dakota was so early on in doing this. And then Washington State, they have an app called COVID Safe. Right now it's only a demo, but it's something that's being developed by the University of Washington. And it looks like they're going to be moving forward in that direction. So that's for all geolocation-based apps. Then, the big news that most people have heard is that Google and Apple are working on proximity-based tracing, so using the Bluetooth-based approach. And so what the companies are doing here is they're not actually building apps themselves. What they've done is they've come together to create a single API, so an application programming interface, that public health authorities can then use to create their own mobile contact tracing apps for exposure notification. So far, 4 states in the United States, Alabama, North Dakota, which is adding on to what they're originally doing, South Carolina, and Virginia have all signed on to use this type of this API. And so, in this model, the users are deciding, do they want to download this app from the state public health authority? And if they do download it, then they also would decide on their own whether, if they have an infection, they want to report it. So with each of these methods, there's certainly different pros and cons to them. For geolocation, the pros are that you know exactly where people were, which also makes it easier to, for example, alert a facility operator of a potential risk. So not just we're different people that were infected, but hey, this particular restaurant maybe needs a deep clean. Some of the cons, of course, are that geolocation can be far from perfect. It can be very imprecise, depending on how geolocation is done. GPS is accurate to about 16 feet, but that accuracy declines indoors and in certain environments. If it's using Wi-Fi, sometimes it has better accuracy, sometimes worse. So there's a possibility for a lot of false positives, especially in certain areas, like maybe a high rise. There's also, some privacy concerns here because of the fact that when you're tracking location, that is very much tied to identity, and it's very hard to de-identify that effectively. So if you're providing all that information, especially if you're providing that to the government, it could potentially be used for other purposes. Then when you look at proximity-based tracing, obviously one of the biggest pros here is that it can be less invasive. You can have more anonymity here. The cons, of course, are that there's also, again, a lot of potential for false positives. For example, you might have two people in an apartment where they're within 20 feet of each other, but they're in two separate apartments and you have a wall between them. They might still register as having had a lot of exposure. And so it's really hard to identify the specific circumstances under which exposure may or may not have occurred, which might give better insight into the actual risk. The other challenge with both of these methods is that there's the question of how do we actually get to high adoption numbers? Oxford University did a study where they found that you really want to have about 60% of the population using these apps to be effective at stopping the spread. If you have lower numbers, you can reduce it somewhat, but you really want to hit that 60% number if we want to have an impact on stopping the next pandemic. But getting to this number would be very hard, right? Because first of all, there's only 4 out of 5 Americans who actually have a mobile device. So you're starting with 20% of the population taken out of this. Second, surveys show that Americans are divided about half and half in terms of whether or not they support these types of apps. And third, especially if we move in the direction of Bluetooth, only about half of users in the past enable Bluetooth on their phone, mostly because they're concerned about battery life. And so it is a challenge. How do we actually get there? So the second thing I want to talk about is the legislation in this space. Right now, there's 2 federal bills that address privacy around these tracking apps. One is the COVID-19 Consumer Data Protection Act. This is sponsored by 3 Republican senators. It requires prior notice to individuals before any data collection. It requires the app to get affirmative express consent from individuals. They have to have a privacy policy. They have to produce a public report on the number of individuals who have downloaded and used the app or that they're collecting data on. They have to have an opt-out mechanism, and they have a requirement that if you want to delete your data, you can delete your data. All of this would be enforced by the FTC, and it would preempt any state laws in this area. And this law would end when the pandemic is over. The other bill that was introduced by 2 Democratic senators, Blumenthal and Warner, as well as introduced in the House. It's the Public Health Emergency Privacy Act. Very similar to the other bill. It has the opt-in provisions. It has the ability to delete your data. It limits disclosure to government, but it also establishes a private right of action. So if one of these companies makes an app and then they misuse the data in ways that violate these rules, you can sue them directly. It does not preempt state laws, so states could create their own policy in this space. It establishes voter protections, so it says that nobody can be denied the right to vote for not downloading this app in case any state moves in that direction. And it requires HHS to produce a report on any civil rights violations that may occur from the use of these apps. Some of the critics of this bill say that it doesn't go far enough in terms of barring other types of discrimination. So for example, you could still have an employer deny someone a job. A school could say you can't come to the university or something like that if you don't download this app. So there is still that risk there. We do also see, state and local governments doing some of their own things. Washington State, for example, has their guidelines on reopening restaurants, and this has a requirement that restaurants maintain a 30-day log that would include contact information, so phone and email of all customers that come into their premises, as well as the time they were there. Cook County in Illinois just passed a resolution to provide police officers and first responders with the addresses of everyone who tests positive for coronavirus. So what we see in this space is there's still so much movement. There's so many kind of unanswered questions about what this will look like. A lot of these are guidelines or pending bills. So there's a lot of moving parts. And the last part I'll just mention, everyone of course always says, well, what about HIPAA, our federal health privacy law? HIPAA of course doesn't apply in many of these cases because it's not a health provider that's collecting the data. And if the health provider is not collecting the data, it's outside of the bounds of HIPAA. So those privacy rules don't apply, which is why people are thinking about new laws in this space. So I'll stop there, but happy to go further into any of this.
Thank you very much, Daniel. I'd like to turn now to the second panelist, Thomas. All yours.
Okay, thank you, Eric. Good afternoon, and it's an honor to be with you all. I'd be happy to give you an insight into the Brussels perspective. I'd like to start off first with a quick overview over the data protection landscape in the EU. Second, to showcase some reactions on COVID-19 and privacy issues at the EU level. And then thirdly, take a look at what's actually happening on the ground. Well, I think it's useful first to quickly clarify who does what in the European Union in the fight against COVID-19. Remember, the EU is a collection of 27 member states. It used to be 28, but that's the past. So these 27 member states are in charge of public health issues. And obviously that means they are also in charge of fighting COVID-19, but these member states are set up differently and organized differently. You have central member states such as France, and then you have federal organized countries like Germany, where actually fighting health issues is a task for the municipal, the local level. The European Union comes in only when there is a coordination effort needed. And that explains why you can read in the press or in the news mostly about national responses to COVID-19. Germany does this, France does this, etc., etc. However, when it comes to data protection, privacy protection, this is actually a fully unified European Union competence. And as Eric has already referred to, the one single instrument with the rules on data protection, it's the GDPR. And the application of these rules is charged to 27 plus national supervisory authorities, which then themselves coordinate at European level in the European Data Protection Board. And the supervisory authority I'm working for, the European Data Protection Supervisor, is part of that European Data Protection Board. There is a little twist because health legislation still may interfere with GDPR rules on data protection. But in principle, the GDPR lays down the rules in a unified manner for the whole of the European Union. And what does the GDPR say? Just as a reminder, it actually starts off with saying processing of personal data should be designed to serve mankind. That sounds interesting in an era of COVID-19. So it means that the protection of personal data, the protection of personal information needs to be considered in relation to its function in society and may have to be balanced sometimes in relation to other fundamental rights, such as the health of other people. So this is why if you look closely in the GDPR, you'll find, you could even say it's been designed that it has, it serves and puts down the rules for processing of personal data, even sensitive data, in the fight against communicable diseases, such as this pandemic. It has rules for protecting against serious cross-border threats. So in a sense, the GDPR allows the processing of personal data, even sensitive health information, for reasons of substantial public interest. Of course, there are conditions. You need to have a law, or it needs to be proportionate to the aim pursued. But in essence, you have a technologically neutral, unified, single regulation, which applies in the whole EU and which lays down the rules of the road for processing personal data. And any technology which processes personal data must fit within this EU law. So then it might not come as a surprise that for data protection issues, the reaction on COVID-19 at EU level were threefold. You have the three main actors. The first, again, the European Data Protection Supervisor, which is the independent institution for EU institutions. We have come out very early, 6th of April, and we have been calling for a pan-European model app, because that was the discussion already on contact tracing apps. The European Commission, then the EU executive, came out also in April, first with a recommendation and then on specific guidelines for data protection and app for contact tracing. And then finally, the European Data Protection Board, 1 week later, produced actual guidelines on the use of location data and contact tracing tools. I have to say, this was produced, all of these recommendations, guidelines, by the way, the references to those will be sent around later on. But these came out very quickly in record time for an EU public administration. This was done very quickly. And these guidances, they address policymakers and app developers, which is also, I think, a first. So what do they say? Basically, this can be summarized very briefly. Data protection is no obstacle in fighting these pandemics. On the contrary, data protection is part of the solution. And they all acknowledge that the use of contact tracing apps can be useful, but only as a complementary action. Other solutions exist. It can't be the only solution. All agree at European level that data protection by design principles should be applied. There should be minimum use of personal data. Location data, geolocation data is a big no-no because that is not required for contact tracing apps. It tends to support the Bluetooth technology. They all say installation of contact tracing apps should be voluntary, as should be the notification to the app if there is a positive symptom as a positive COVID-19. Everything needs to be done with full information and transparency, and it needs to be interoperable, because obviously in the EU, without internal borders, in principle, people will travel again, and for that you need to have interoperable apps. And this must be, all of these apps must provide full information and full transparency about who does what in information flows. So, third point, I think there were three important developments during this time, and Eric and Daniel mentioned some of them. But let me first go to the one initiative that scientists actually came forward first with ideas on how to design proximity tracing, contact tracing apps. Not politicians or some official institutes. You could really see different nations, different backgrounds working together and proposing. The two most prominent solutions are the PEPP-PT, that's short for Pan-European Privacy Preserving Proximity Tracing, and the competition, the DP3T, the decentralized privacy preserving proximity tracing. These are all frameworks Daniel already mentioned. The main distinction is the approach. Where should the data be hosted and centralized? One is more a centralized solution. The other one tends to go and say it should be all more decentralized. The second important development was the joint Apple-Google initiative, which is really a hugely influential, I have to say. It's a game changer. When it came out, that was clear. When two competitors join with almost 99% of the market share for mobile devices, that must be important. And interestingly enough, from a European perspective, from a data protection perspective, certainly, this initiative ticked all the boxes on privacy by design. So applause from that side. Obviously, these two giants still reserve the right to decide who gets access to the APIs, which is that didn't work so well with some of our politicians, in particular in France, who are concerned about digital sovereignty. So let's take a look what happens actually on the ground. There was an interesting discussion in the member state I know best, in Germany. We don't have a proximity tracing app yet. It's being developed. For a long time, the discussion was favoring a more centralized approach. That's what the government wanted, the federal government. But after a long discussion with the data protection authorities, and after an open letter from scientists and academicians who were speaking out against a centralized solution, the German government, in a surprise shift, then announced they would use the Google Apple initiatives API and go for a decentralized approach. In sharp contrast, as you can imagine, France, in France yesterday, the French Parliament actually approved a proximity tracing app. So you see, that's the level of discussion where these things are being decided. After a positive, okay, green light from the supervisory authority. But this will not be based on the Google, Apple APIs, and it will be a centralized approach. So, and there are a plethora of other apps being developed in other member states, but they haven't seen the light of day yet. So I think, in short, and as a summary, I think in Europe, we seem to have the opposite situation as in the US. We do have the data protection legal framework firmly set in place. And now it's more a question of how to design apps or technological solutions in the fight against COVID-19. And obviously the challenges which Daniel mentioned are the same for us here in Europe as well. Will it actually work? Will there be a sufficient numbers and uptake, et cetera, et cetera? And I'll close with that, and I'm looking forward to your questions. Thanks.
Thank you very much, Thomas. Maybe I'll start off with a question, and I'll start with Daniel. You mentioned a few, actually two federal initiatives. How much are these in conflict or not with, say, California state laws or other state laws? Is there, Thomas was mentioning that the checkboxes were all checked for the GDPR in terms of Apple and Google. Where are the sort of relationships between the proposals at the federal level and the various state initiatives?
Yeah, so the main thing we've seen is that over the past 2 years, states have been very aggressive in starting to pursue new data protection laws. So you mentioned, Eric, the California law, CCPA, went into effect in January, but it's set for enforcement to start July 1st. And even there, the regulations aren't completely clear. There's still, the Attorney General is still finalizing those. So it's not clear exactly how they'll impact it. For one, consumers will have to have a right to delete their data, in California at least. So that's something that comes into effect. There's also a number of states that have specific biometric state law privacy bills. So if you're collecting any kind of biometric data, which, sometimes that, can fall into inferred health information even, or health information. There's also state laws on that. There can be, there can be discrepancies there. That's one of the reasons there's been a huge push over the past year and a half for comprehensive federal privacy legislation, not just for COVID-19, but just across the board to settle some of those questions. But it doesn't look like we're going to get there right now. The big sticking points in the current draft bill is that, one, there's a question about, would a federal bill preempt the states or not? And given that California has this new bill they've spent a lot of time on, the California delegation really wants to see any federal privacy bill at least be on par with what California's done. And the second, big obstacle is the question of a private right of action. That's something that, a lot of the, trial lawyers have been strongly pushing, and, there's others that have been pushing back against that. And so that's been one of the biggest sticking points. Right now, it looks like there might be a very narrow private right of action. So what this would do is it could grant individuals the right to sue a company to get an injunction, forcing them to comply with a particular provision if they're not complying with it, but no monetary penalties. And it seems like maybe that's where the negotiation might go on those bills. But there's a lot of discrepancy right now, which is creating, that very uneven framework. And I think that's why, we're really seeing a state-by-state decision about whether or not to adopt these bills. Of course, the big problem with that is once we actually start reopening the economy, people aren't confined just to their particular state. And so, if you're in, North Carolina and you're taking a day trip to Washington, D.C., going through Virginia, maybe going to see someone in Maryland, which app are you using and where's the data going? And are you missing people because of the fact that, you have the North Carolina app and you don't have the DC app or the Virginia app or the Maryland app? And so I think it's, there's this lack of, national vision for how this will actually work right now. And I think that's a huge problem. And it's something, some of the states might figure out by working together and creating one app. But right now, the idea of 50 different state apps doesn't look like it's going to be, something very practical.
Thanks. Actually, let me ask you a related question. Suppose I travel from Frankfurt to Thomas. Suppose I travel from Frankfurt to Paris. What happens? Is my data depending on what phone I have, whether it's a German phone or a French phone, is the French system applied to when I enter French territory? What's sort of the situation right now? What's going to happen?
Well, that's a very good question. In Germany there used to be a predecessor app which you could only actually use if you had a postcode in Germany and a telephone number in Germany. So that wouldn't work then if you were in France. But that's exactly the reasoning behind this European institutions' appeal to coordinate from the European Commission side with member states to say, look, you can develop whatever app you might think is necessary, but it needs to be interoperable. And this is what goes on in the background at the moment, that member states are working on trying to find ways to actually make these apps talk to each other so that indeed when you travel from Frankfurt to Paris, that the information on who is positive, who might be in your area is not lost, and that you get the warning. But that is a challenge which is still going on, and I haven't seen the solution. It's the vision. This is where they should. This is where the Europeans should come out with, but I haven't seen it in actual application yet.
Let me read one of the questions. With the behavior in capitals of Apple and Google regarding this technical issue and other general issues, why should we trust their data? Who will monitor their work so that it is transparent and accurate? So, anybody wants to give a thought about what we should worry about with the Apple and Google app in terms of monitoring and accuracy?
Well, I think the accuracy part is something that we don't know yet, and some of it will depend on the specific devices. But in terms of the question about are they doing what they're said they're doing, they have put out public statements. There's a website devoted to specifically stating what they're doing. They created model code for states to use that anyone can download and take a look at. I think they're being fairly transparent, and with that transparency comes enforceability. So if they've made any of these public representations about the fact that how they're encrypting the data, how often they're changing the identifiers, who has access to this information, if any of that is untrue, the FTC can take enforcement action against them, as we've seen with Facebook. They're not afraid to do that.
Thanks. I'll read another question. The Apple-Google approach, any app using the API is interoperable, right? Can it be? I don't know exactly what interoperable is, but I guess it communicates with any app on the phone. Is that the question?
If they can, the promise is that if you're using these APIs, and because they're both implemented by Google and by Apple in their operating systems, the promise is that indeed everyone who uses these APIs will make sure that it is interoperable, so that these apps can talk to each other, essentially. That's the whole idea, and that's the whole interest from governments also in the uptake of this initiative, because obviously, as Daniel has mentioned before, you need to have a huge uptake in the population for these proximity tracing apps to actually work. 60% is this number from the Oxford study. And if you want to do this, you need to reach out to as many people as possible. And the best way to do is to go directly to those who have the phones. And this API from Apple and Google, they promise that it would, you see, since it's integrated into the operating system, it makes it much easier. And if I may just add to your previous question on the trust issue, I think also Apple and Google are very careful in saying they're just providing basically the infrastructure, but the decision on should there be an app and who gets the information is then left to, at least in Europe, to the individual member states and their public health authorities. Plus, and that's the data protection angle, there is no coercion in you have to install these apps. It is based on a voluntary approach saying, look, this is something which is privacy preserving. If you install it, that's your decision. And if you want to notify about your health status, it's your decision as well. So it's really a big, a huge effort on trying to get as much uptake as possible.
Thomas, I'd like to have a follow-up question on what you said about France, which has opted for a more centralized system. Is there any clarity on how long that data will be stored? Is there a specific about that? Is it going to be deleted after a number of days, or will it be somewhere sitting for a long time?
Well, again, as long as the crisis is with us, I suppose we'll have to have this information. If you do the Google, Apple, if you follow that protocol, that's being stored on device, and the communication is on different devices. So as long as this functionality exists, as long as we have the pandemic, that's the timing. But from a data protection point of view, from supervisory point of view, it's also very clear, if the pandemic is over, and we all hope that is rather sooner than later, then all of this needs to stop and disappear. And I think Google and Apple themselves, they have said they will have a kill switch and they will stop that functionality once we're there. But of course, we are not there yet.
Thanks. The next question is for Daniel. when would HIPAA apply to data collected for contact tracing tools?
So, HIPAA only applies in the context of, providing healthcare or, somebody kind of in the healthcare chain, insurers, pharmacists, something like that, a nursing home even. So, if you're just running an independent app, as we're seeing in this case, that's not going to be data covered by HIPAA. If somehow it was an infection was reported directly from a doctor, that information might be covered by HIPAA. Although sometimes, if it's mandatory reporting for public health purposes, then it falls outside of those, or it's at least allowed under HIPAA. And then, when the public health authority has that information, it's maybe under some kind of state rules. So that's the reason that, we are seeing these proposals for federal data protection legislation specifically around, COVID tracing, digital tracing apps, because of the fact that all this information likely falls outside of that. And, the goal is with legislation like that to give consumers, peace of mind that, yes, there is oversight here. Yes, even though it falls outside of HIPAA, there are guidelines and enforcement. And that, it enables us to have some clear rights around how this information can be used. That's enforceable through law, not just through, statements that the private companies have made.
Thank you. The next question actually is for Thomas. Do you expect that the current situation will accelerate the works on the reforms of the e-privacy framework? If so, what kind of developments may it lead to?
That the e-privacy framework is the little sister of the GDPR in a way, but we're not there yet. So it adds essential rules on the confidentiality for electronic communications, usually known as the cookie directive as it is. At the moment, there is no progress on this file between the European legislators. I don't think the COVID-19 crisis will change a lot into this aspect, simply because there is no energy to discuss any specificities other than the general principles which are already there under the GDPR. As much as I would welcome any progress on this front on e-privacy, I am at this moment not particularly optimistic that because of COVID-19, there will be a progress in this file.
So the next question is, so currently there isn't a US federal law in place that would prevent Google or Apple from following or tracing our phones and where we have been, correct?
So there's not a law that says they can't do that. There is, of course, the Federal Trade Commission Act, which says companies cannot engage in unfair or deceptive trade practices. And so, both Google and Apple say they respect people's privacy. They have long privacy policies outlining how they handle consumer data, including location data, and outlining what they do with it. And so that enforceability is what enables us to say these companies are not doing it, and if they were to do that without notifying us and going through a very public disclosure process, that they would be held legally liable for those kinds of actions. And that's really where this difference between the U.S. approach to privacy and the European approach to privacy appears. We don't have a law that says you can't do these things. Instead, we have these statements that companies make, and then we force them to abide by those statements. And it's a very different approach, but it is an approach that has allowed certain flexibility. And if I can just go back to something Thomas had mentioned earlier, it is interesting to me that while Europe has the GDPR and kind of from the outsider view, we initially think of it as having this comprehensive approach to privacy. We did see with the COVID-19 crisis, each European member state, EU member state, really have to issue its own DPA. Each DPA had to issue its own statement saying, here's how the GDPR applies within the context of how we've each implemented the national law. The Italian Data Protection Authority had to grant an exception to allow new types of data processing for one of the civilian authorities through the end of July, specifically because they said, we probably couldn't process this data otherwise, and we need to grant an exception to what the GDPR allows. So I think there is value to a national approach. I think that's something the US really can learn from Europe. I think we have to be careful about how we do it, because even in the European approach, I don't think it's worked completely seamlessly. And ideally, that's what we want to see happen in these types of situations. We want to see seamless data collection and reporting of this information. Right now, even at the local level, you see these problems where, New York City, they don't know how many cases they have, but New York State does. Or, a state's trying to collect information about how many, infected people they have. But if it's happening at a meat processing plant, that information is going to the USDA instead of going to the state public health authorities. And the ability to pull information is so critical, and we have to be designing these kind of data systems with the idea of a national and sometimes an international view.
I'm sort of curious, Daniel. We've seen the number of cases reported across states in the US. I was surprised that arguably the states that had the most cases, I'm thinking about, for instance, New York, you didn't mention any of those in terms of the state initiatives. Most of the states' initiatives that you mentioned were states that had relatively, at least for the moment, a small number of cases. Is there a rationale for that, or is there something you understood here?
Yeah, no, it's a great question. I'm not exactly sure why. I would say, we've done some work looking at kind of state leadership in terms of, we did a report a couple of years ago looking at which states basically had the best state level websites. So, who were using the most advanced technology, who were most mobile friendly, fastest pages, accessible design, and best security. And you did have states like Utah who were at the top. And so I actually wasn't surprised to see Utah was one of the early adopters of moving forward with its own app. North Dakota was an outlier, again, because they basically had this app they were already using for another purpose, and they just repurposed it for COVID tracking. All the other states, I think there's a little bit of a, once Apple and Google came out and said, well, we're going to develop a solution, the states said, well, we'll kind of wait to see what they do, and then we'll start moving forward. And a lot of states, they've really focused on, instead of relying on that app tracing, which again, may or may not work, we're still waiting to see if it actually pans out. They've really been focused on, the in-person contact tracing. So how can they get, the Johns Hopkins University said we need 100,000 additional trained contact tracers. And so I think a lot of states have really been focusing on how do we scale up that kind of workforce? How do we make sure that workforce then has the tools they need to actually enter the information, that they have the call center set up so they can reach out to people, log the information. I think they've been working on some of that back-end technology instead. I think it's probably a little bit of a different focus, but I'm not sure. There's other states that I would think would have done more. Texas, Virginia, Georgia. Those are all states that have generally been very forward-looking in their technology, even Colorado, and those states haven't done anything either.
I have a question for you, Paul. You sort of mentioned the French versus Apple, Google. Where do you see the European landscape going in terms of countries that are going to take the Apple, Google app, like you mentioned, Germany? Where do you see sort of things going? Are the French going to be just an exception, or is it getting more divided?
I'd say the offer on the table from Google and Apple is just too convincing because, as I said before, it's simply the vast majority of mobile devices. So I don't think you'll see a lot different apps which will not be based on this API. But I think the French approach shows one thing, that Europe is also realizing how much dependent we are on these technological solutions from these companies which are not based in the EU. So I'm sure there is a lot of thinking already ongoing in the European circles on taking this as an example, or should I say, yet another example of in times of crisis and in need, that Europe needs to build and have its own technologies. Simply because imagine there wouldn't be the Apple and Google solution, or it would look differently. It would not be privacy preserving. It would be anything goes. Then we would really have a problem. So I think in this particular case, I don't think we'll see great differences in approach, because we're in a crisis still and we need to react fast. But I'm sure it will serve as a watershed moment in European thinkings on digital sovereignty.
Thanks. Indeed. Next question is for Daniel. Does the recent California Consumer Privacy Act present any additional complications in the U.S. implementation of contact tracing programs?
Yeah, I mean, I think the main thing there is just, there's a private right of action in CCPA in the California law, as well as, if there's a data breach, I think a lot of companies that might be making an app or collecting the information, for example, if an employer is requiring employees who are coming back to work to install these apps and maybe notify them, if there's any kind of data breach there, and all 50 states now have data breach laws, there can be potential financial consequences of that data breach. So I think that's where, there's the most kind of organizational risk for collecting this information.
The next question is still for you, Daniel. You mentioned technology powering manual contact tracing aside from Salesforce database being repurposed for contact tracing and data brokers helping with identification and contact information of people at risk. Do you have any other specific examples of technological solutions to assist manual contact tracing?
Yeah, I know there's I know there's at least one app out there or a service that's being used. I thought it was called COVID Link. I haven't looked closely at it, but when I was reviewing what some of the different states were talking about, I know at least one state mentioned a specific application that was being used for some of this manual tracing. And then I think others, some are using, Excel spreadsheets and, very, or, manual or paper-based methods even.
Thanks. I think we are kind of running against our time clock. So I would like to thank both Daniel and Thomas. This has been a great conversation. It's not the end of that conversation. I think there are still quite a bit of issues, and I see that we could easily schedule another webinar on data privacy as we move forward. Again, I would also like to thank all of you who participated in this. This was a very interesting and provoking conversation. Thank you again. Thanks.